Bariatric surgery can transform your life, but it's really important to understand the criteria, steps, and guidelines to be successful in bariatric surgery. Hi, my name is Untitled. I'm a world-renowned bariatric and robotic surgeon. I've done surgery on over thousands of patients, as well as been privileged enough to teach hundreds of surgeons throughout the world. Through this video, I really want patients to understand the processes of bariatric surgery. Who qualifies for bariatric surgery? Well, this is a great changing question. For the longest time, bariatric surgery had one standardized criteria for weight loss. Patients would have a BMI that would be greater than 35 to 40 with a medical problem, or a patient that had a BMI of 40 and higher, even without a medical problem. So first question is, what is BMI? BMI is a calculation of your height and your weight. Easy to find this out. Go to Google, type up BMI calculator, and put your number in. So if your BMI is 35 to 40, you would need a medical problem. What are those medical problems? Hypertension, diabetes, it could be a fatty liver, it could be sleep apnea. There's a copious amount of medical problems. It all depends on your particular insurance. If that BMI is 40 and higher, typically you automatically qualify for bariatric surgery. Well, since the introduction and the widespread use of GLP-1s, insurance companies are understanding that they're actually losing money by patients being on GLP-1 medications. There was a recent study that showed 9 months of GLP-1 medication for insurance companies are equivalent to bariatric surgery when it comes to cost. So what they're doing is they're lowering the cost and lowering the BMI of bariatric surgery to patients. Why are they doing this? Well, another step is that although GLP-1s are widespread, unfortunately, because of the cost, the side effects, or just plain being a medication you have to take forever, if you ever get off that medication, your BMI typically goes back to what it was prior to the medication or even higher. All the studies have shown that. So what insurance companies are seeing is that they're spending a lot of money on medications. Well, those patients 6, 8, 10, 12 months are still going back to needing surgery. So those new criteria, and once again, this is really dependent on your insurance, can be as low as a BMI of 30 with a medical problem that would qualify for surgery. So the best way of knowing your criteria, if you have insurance, is for you to look up your insurance and call your insurance to see what the criteria is. If you're a self-pay patient, the criteria is what is accepted by all the international guidelines, which is a BMI of 30 and higher for patients. So let's say now we have qualified for surgery. We've noticed that went through your insurance. Let's say you're having insurance. We have deemed that you have the appropriate BMI, medical problems, and your insurance covers surgery. Where do we go next? Well, the next step is to come see me. I can see you either virtually or in person, and then we go over not just what surgery you're gonna have, but what we're gonna do before surgery. Why is this really important? Well, not one operation is good for all patients. There's certain patients that have different criteria or they have different goals of what they're trying to achieve. It's different for a patient with a BMI of 60 that's healthy than let's say a patient has a BMI of 40 with significant diabetes. That patient is different. Let's say a patient has really bad reflux. Maybe that patient I'll look at differently than a patient without reflux. So it's really important to one, go to a surgeon who does every operation, that is the sleeve gastrectomy, gastric bypass, duodenal switch, single anastomosis duodenal switch, as well as any revision. That, therefore, the operation that you choose isn't the one that is dependent on the surgeon, it's dependent on you as an individual. So now I've seen you in the office, we've talked, we've now come in line of which operation, we've talked about the benefits, the risks, and the pros and the cons, and we've chosen the operation. Well, now we're going to talk about what needs to be done before surgery. And once again, if you're an insurance patient, this is really important because insurance sometimes has different guidelines. Some insurance requires you to see me for 0 months, or just one visit. Some require you to do 3 visits. Some require you to do 6 visits. Some require you to see me 12 minutes before they would approve surgery. So we're going to go over those guidelines and we're going to map out a whole schedule for when you have to see me and what needs to be done at appropriate times. So as we're doing those visits, we also then have other checklist items to complete. So really important, we want to make sure, since this is an elective operation, that we're at your health peak. So depending on your medical history, whether you have bad diabetes, heart disease, you can need cardiology clearance. You will at least need medical clearance. And this helps us reduce the risk of surgery. This is why a lot of these operations are as safe as getting your gallbladder out, because we can really optimize your health prior to taking you to the OR. So once we've delineated whether you need a medical clearance, a cardiology clearance, or pulmonary clearance, now we have to make sure we look at your mental well-being and if you're mentally ready for surgery. So we'll have clearance through a psychologist or some type of psychological evaluation to assure that you're ready for surgery and you understand what surgery entails. Next, a lot of times if you have bad heartburn, we do want to evaluate your stomach and your esophagus, whether that be through a upper GI, which is a radiological study where you swallow some dye and we kind of look at what happens, or with the upper endoscopy, where the gastroenterologist or myself will put a camera in your mouth and take a look in your stomach to make sure everything looks okay. And lastly, and probably most importantly, you get to see our amazing dietitian. We go over your preoperative plan on how you're going to start eating now, and most importantly, afterwards, so you know what to expect and you know how you're going to eat afterwards, so you have the best long-term weight loss. So now we've completed your guidelines. I see you every month. So before surgery, I know a lot of surgeons won't see their patients except the pre-op time or just see you in your first visit and right before surgery. I like to see my patients every month before surgery, and every visit of yours will be with me. So now we've seen each other, we've developed a relationship, you've done all your clearances, and now what? Well, we submit your paperwork to your insurance, and then we get the approval. Once the approval is there, then you and I will speak one more time for your preoperative class and preoperative teaching, and then you have surgery. What does after surgery look like? Well, you have your booklet, which will tell you how to eat after surgery, depending on which operation you have, which vitamins you need to take, when you need to follow up with me with your vitamin levels. But let's talk about our visits. Well, first and foremost, you have my cell phone number and our office number 24/7. Anytime you ever have an issue, whether it's 10 days after surgery or 10 years after surgery, you let us know. Additionally to the appointments that you have with us, we also have the ability for you to see our dietitian. So depending on what you need, we have our dietitian available that works with us, that you can talk to her, email her questions, even have a support group that you can talk to her on a regular basis. So how often will you see me? Pretty often. I'll see you 10 days, 6 weeks, 3 months, 6 months, 9 months, and a year after surgery. And the best way to be successful is for you and I to develop a lifelong relationship. So even after that first year, I want to see you every 6 months to a year to make sure you're doing okay. And that will help us alleviate, if there's ever a time where you're having some difficulties, you're gaining some weight back, we can talk about it and we can reevaluate what we need to do. At the same time, no matter which operation, we're going to have to check your labs. Some operations, like the duodenal switch or the SADI operation, we might need to check your labs a little more frequently. However, some of the other operations, like a sleeve or gastric bypass, we might need to check those labs every 6 months to a year. But we do need to check your labs and make sure you're taking your vitamins appropriately. So people talk about bariatric surgery, and they talk about not just the surgical aspect of things, and they kind of think about, hey, you lose weight because you don't eat as much. But people don't really look into the psychological aspect of weight loss. So as you heard, we do get a preoperative psychological evaluation that's very important. The real importance to understand is that this operation is not a quick fix, it's not an easy way out. What it is an effective way out. Meaning that if you're in the right place in your mind, this operation is not just a short-term weight loss. This operation, you can have weight loss forever. But how do you do that? Well, the first year you lose weight. we know you'll lose weight. So my goal is not for you to lose weight the first year. My goal is you see me back 5-10 years down the line, you keep this weight off. And how do we do this? Is that first year, you really can't eat very much, meaning that you get full with small portion sizes, your body won't allow you anymore. However, like everything, your body does adapt. So you will always get full quickly. But the goal after that first year mark is to know what that fullness feels so you don't eat more food than you can. So what my goal is for that first year is not for weight loss, like I said, which you will lose weight, is for you to develop really healthy lifestyle changes, meaning that your diet changes and becomes very healthy, and more importantly, or just as importantly I should say, you also develop an exercise routine. And when we talk about exercise, nobody's talking about becoming a marathon runner or a triathlete, although I've had multiple patients that have operated in the past that did very high level athletics or did marathons or did triathlons. But what exercise is, it's just being able to increase your heart rate for at least 30 minutes a day. That could be walking, that could be jogging, that could be playing tennis, that could be doing any hobby you like to do. But for at least 30 minutes a day, 5 days a week, just elevate your heart rate and make that into a pattern and a habit long term. If you're able to develop these lifestyle changes, I promise you you'll be successful not just for today, but forever. Let's talk about some common questions we have before surgery. One common question we get is, do I have to do a liquid diet before surgery? Well, first, let's talk about the benefits of a high protein liquid diet or a liquid diet itself. Well, what it does is it shrinks your liver. What does shrinking the liver cause? Why do we need your liver to be as small as possible? Well, if you look at a roadmap of your abdomen, your liver kind of lies right on your stomach. So the smaller your liver it is, the more we can lift your liver and it helps us see your stomach better. So obviously if the surgery is easier for me, then the surgery is also easier for you as a patient. What happens if you don't follow a guideline? I get this all the time. Well, couple things. One, it depends on when, right? So right after surgery, it's really important. You walk, you drink, you do these things. Or if you don't do these things, let's say you don't drink, you'll get dehydrated, you go to the hospital. Let's say you don't walk and you get a DVT. Well, that could be a more serious problem that we need to alleviate. How about longer term when it comes to diet? Because that's what most people talk about. Well, usually long term, if you don't do the right diet, what happens, not really do you hurt the surgery, but you end up hurting yourself, meaning that you end up maybe gaining some weight back, having more calories, and that long-term weight loss is not as long-term. Most patients will lose significant amount of weight, like we talked about at 1 year out. But how do people, or some people, gain some weight back? Well, they lose the priorities that weight loss surgery was that first year. They might be doing things they used to do prior to surgery that could cause some issues. Following the guidelines is very, very important. Before surgery, after surgery, and long term. We want you to become successful. We want to be a part of that success. And that's why we really think it's very important for you to follow with us, not just immediately after surgery or 6 months after surgery. Follow up with us forever. If you're considering bariatric surgery, understanding these guidelines are the first step. Schedule a consultation with us at Tampa Weight Loss Institute to get personalized advice and guidance. Please look us up at www.tampaweightLossInstitute.com or call us at 813-592-2392.